My name is Joe Kutzin of the Health System Governance and Financing Department at WHO headquarters in Geneva. As you know, the role of private actors in the health sector of many countries is both large and diverse. In terms of service provision, it consists of both licensed and unlicensed entities ranging from drug shops to specialized hospitals, both for-profit and not-for-profit, and both domestic and foreign. There are also private actors involved in health finance, manufacturing and supply chain, and other aspects of health systems. Given this reality, governments need to use their array of policy instruments to guide these entities towards the objectives of sectoral equity and efficiency on the path towards universal health coverage. The selection of policy instruments should enable an inclusive public policy framework for health, allowing ministries of health to steer diverse interests, including those of both public and private actors, to ensure the achievement of health for all objectives. To align this diverse set of actors towards these objectives, WHO has long advised that ministries of health in particular take the lead, in many cases shifting the role of the state from rowing to steering. A coherent approach to public policy towards the private sector in health means several things. First, clarification of the principles and values of overall health policy. Second, outlining broadly the roles assigned for different types of actors in the financing and provision of healthcare, as well as in the production of human resources, medicines, vaccines and supplies, and health facilities. Third, specifying the information and regulatory machinery to achieve these aims. Fourth, and with respect to health service delivery in particular, outlining the mechanisms for assurance of quality and the roles of different government, non-government, private, and professional bodies. Fifth, providing information to the public in order to clarify what they, as consumers, can expect in the way of service quality and accountability from health entities of all types. And finally, identifying mechanisms for consultation and coordination among different entities. Taking such a systematic approach is necessary for two reasons. First, because ministries of health are responsible for the entire health sector and not just the part for which it has direct financial and managerial responsibility. And second, frequently, the push for greater private sector involvement has not been driven or aligned with either efficiency or equity goals for the health system. The guidance on health system governance should be made publicly available by ministries of health. It is also important to note that the drafting, publicizing, and discussion of it are essential steps in establishing its existence and legitimacy as a code of practice for all actors in the health system. Ministries of health need to be aware of the range of tools and techniques available to them for managing the actors, both public and private, involved in the different functions of the health system. This is more than a nice to have. There is a need to have more inclusive public policy for health to maximize efforts and achievements for universal health coverage.